Why are we not spending our time today examining this crisis within a crisis more closely? I hear from providers and hospitals about issues with PPE. I know this administration has done extraordinary things to secure more PPE. I want to thank President Donald Trump for his strong leadership. Not only did his administration move quickly to coordinate a response, but his travel ban on January 30th was a bold move, though it was panned by his critics as an overreaction at the time. The administration has gone to great lengths to overcome an inadequate system they inherited. As you testified earlier, moved quickly to start programs like Project Airbridge to expedite more PPE coming in. But questions remain about why there is a global shortage and what more Congress can do to support the administration's efforts to secure sufficient PPE. This committee should be working on that question. We have multiple pieces of bipartisan legislation waiting to be considered to improve the operations of the Strategic National Stockpile. We should be examining why our stockpile was allowed to dwindle under previous administrations. The answers to these questions and solutions to these problems are timely and critical to helping this administration combat this virus and the deadly disease it causes. I hear from constituents every day who are suffering under these stay-at-home orders. This crisis is hard for anyone, even if they weren't suffering from substance use disorder or mental health challenges before they were confined to their homes. And this crisis has exacerbated this problem. Why are we not examining access issues to mental health providers and the effects this crisis has had on our constituents' mental health? Dr. Bright, you're no doubt an accomplished scientist, and I appreciate the service you've rendered this country. You deserve to be heard, and your whistleblower complaint should be given the serious consideration any whistleblower complaint deserves. But we also deserve to have the opportunity to ask questions about serious allegations that have been made against you. And I'll note again, this is not the time or place for that hearing. The time is after the Office of Special Counsel has completed its work, and the place is the Oversight and Investigations Committee. But Dr. Bright, building on questions from Mr. Walden and others, Politico released an article yesterday stating that your complaint left out a lot of information and context regarding agency decisions to acquire hydroxychloroquine. You chose not to elevate your concerns to the Office of Inspector General, but instead kept selected screenshots that didn't include full context. Another example, the Wall Street Journal reported on an email today that seems to show that you were in support of acquiring and using hydroxychloroquine. Can you elaborate on what was missing from your screenshots and why you didn't elevate your concerns at any time to the Office of Inspector General?
So the early days of that, when I was aware of the hydroxychloroquine, we were interested in acquiring that drug for its use in a randomized controlled clinical study. Actually, when I heard from Dr. Woodcock that it's something that we should try to investigate in a randomized controlled study, I even reached out to a company that was licensed and approved to make that drug in the United States to see if they could donate that drug to the NIH to conduct those clinical studies. I was aware of other efforts that were ongoing to try to acquire some of that drug for its use in randomized controlled clinical studies. As long as it was going to be used at that time for those randomized controlled clinical studies, I thought we should look into the supply chain the same way I did with remdesivir. It was only after I learned that that supply that was being discussed was coming in from Pakistan and from India, from facilities that were not approved by the FDA, and the drug was not approved for use in the United States, that I became increasingly alarmed of having that drug in the United States. Second, it was when I learned that the plan was to make that drug available through an expanded access program so people could potentially get that drug and not be under the close supervision of a healthcare provider. That caused significant concern. It's because of that and the cascading days afterwards that we put in that emergency use authorization with the safety bumpers and barriers that we could feel comfortable with, that that drug would only be used under close clinical supervision. But in the earlier days, in that email exchange that you're referring to, was before we knew about this information in Pakistan, before we knew it was going to be used for expanded access protocol. It was when I thought our efforts to obtain some of that drug would be used at the NIH to conduct randomized controlled clinical studies. So I was relieved that we did identify some supplies of that drug for those clinical studies.
Jim, my time's expired, Madam Chair. I yield back.
The gentleman yields back.